I'm Noah Wyle, and God forbid you ever need an emergency room. But if you do, I hope you remember something from this. Because the AE's not just a place of alarms and flashing lights. It's a place where seconds stretch, where fear meets science, where strangers become lifelines. And tonight, we're stepping into that world in a way you've never seen before. Not through a hospital drama, not through a scripted storyline, but through questions. Through tension, through knowledge. Welcome to the emergency room. Now imagine this. The lights are bright, too bright. Monitors hum softly. A stretcher rolls past you. Someone can't breathe. A tube is carefully inserted through the mouth, down into the trachea, keeping the airway open. What's that procedure called? One contestant answers quickly. Tracheotomy. Close, but not quite. Another responds with calm precision. Intubation. Correct. And in that moment, you realize something powerful. These aren't just trivia answers. These are real procedures, real skills, real tools that keep people alive. You can almost feel that moment, the relief when air finally reaches lungs that were struggling just seconds before. But that's only the beginning, because the emergency room doesn't just fight for breath. It protects your voice, even when you can't speak. Let's move deeper. A patient arrives, elderly, weak, family members anxious. Decisions need to be made, treatment options, life-saving measures, or not. And suddenly, a term appears, AHCD, Advanced Healthcare Directive. It sounds technical, maybe even distant, but it's personal, deeply personal. An Advanced Healthcare Directive ensures that your wishes are known. If you can't speak for yourself, it speaks for you, and that's powerful. You don't need to be in crisis to think about it. In fact, you shouldn't be. Because when emotions run high, clarity matters most. But what happens next inside the EO often moves even faster. Blood tests, monitors, numbers flashing across screens. A complete blood count, part of that test measures something essential. Something that carries oxygen to every cell in your body. Red blood cells. Low levels, it could mean anemia. Irregular levels, it could point to deeper issues. Even carbon monoxide exposure. You see, the emergency room is like a detective's office, but instead of fingerprints, it reads chemistry. Instead of clues in dust, it finds evidence in blood. And then, suddenly, the rhythm shifts. A patient clutches their chest. Shortness of breath, pressure, sweat. The team moves with precision. An EKG, short for electrocardiogram. Electro, cardio, gram, electricity, heart, recording. It translates the silent language of the heart into lines and spikes across the screen. And those lines tell stories. Stories of blocked arteries. Stories of irregular rhythms. Stories that demand immediate action. But what happens next would change everything. Because sometimes electricity must fight electricity. Join us as we continue to explore the high-stakes world of the emergency room, where every decision can mean the difference between life and death. You'll witness the incredible skill, the pressure, and the human stories behind the medicine. Don't miss what happens next. Subscribe and turn on notifications so you're the first to see our next episode. Inside an EA, there's a mobile unit waiting. Inside, you'll find alcohol swabs, medications, syringes, and a defibrillator. It's all housed in something with a deceptively simple name. The crash cart, there's nothing playful about it. When that cart rolls, time compresses. You might hear someone calling out vitals, another charging the defibrillator, a third preparing medication. Then a voice says, "Clear," a jolt of electricity. And sometimes, after a moment of profound silence, a heartbeat returns. That's the emergency room. It's not chaos. It's coordination. It's not panic. It's purpose. But here's something most people don't realize. The EAE is especially tough on the elderly. Their bodies respond differently. Symptoms can be subtle or confusing. Pain might show up in unusual ways. A minor fall can hide major consequences, and a slight infection can escalate with terrifying speed. This is why knowledge matters. not to replace doctors, but to empower you as a patient or a loved one. Because the emergency room isn't just about treatment, it's also about preparation. Let's slow down for a moment and picture the waiting area. The clock on the wall ticks, and every second feels heavy with anxiety. But behind those doors, a critical system is at work: triage. It's a word we hear, but rarely understand. Triage isn't about being fair. It's about urgency. It's the process of determining who needs help first, who can safely wait, and who requires immediate, life-saving intervention. It can be hard to accept when you're scared, but behind the scenes, years of experience guide every single choice. Now, imagine taking all this high-stakes reality and turning it into a quiz show. Bright lights, an audience clapping, and contestants answering questions about life-saving procedures. At first glance, it feels a bit strange, right? But listen closely. Every question carries weight. Every correct answer represents a piece of vital awareness. Because when a contestant says intubation, they're not just scoring points. They're recognizing a procedure that keeps someone breathing. When they say Advanced Healthcare Directive, they're acknowledging a person's right to choose. And when they say crash cart, they're picturing readiness. Knowledge is the ultimate antidote to fear. Fear thrives in the unknown, and the EA can feel overwhelming. Machines beep, people move quickly, and medical terms sound like a foreign language. But when you understand even a little bit what an EKG does, why they ask certain questions, the space becomes less intimidating. It may not feel friendly, but it becomes understandable. And that's crucial because emergencies don't send invitations. They just happen. But as a side to this we rarely discuss, the emotional toll on the people who work there. The doctors, nurses, and technicians see humanity at its most fragile. They witness pain, relief, loss, and hope, all within a single shift. You can almost imagine them stepping outside after hours, taking a deep breath in the cool night air, carrying stories they can never fully share. And yet, they come back the next day. Why? Because for them, the EA isn't just a job, it's a calling. So what happens when that calling intersects with entertainment? When an actor famous for playing a doctor steps onto a quiz show stage to answer questions about real medicine, it blurs the line between fiction and reality, and that's where our perspective can shift. Behind every scripted medical drama, there's research and consultation with real-world experts. These shows resonate because they echo truth, not perfectly, but powerfully. When those truths are turned into questions on a stage, they reach an audience who might never open a medical textbook. That's the quiet genius of it. Education disguised as entertainment. Because understanding the emergency room isn't just about procedures, it's about people. Thank you for watching. If this gave you a new perspective, consider subscribing for more stories that look behind the scenes. Stay safe and stay informed. Let's step into a single moment. A patient arrives unconscious. No family present. No medical history available. The emergency team must act immediately. Airway, breathing, circulation. These 3 priorities. The ABCs guide everything they do. First, airway is clear and open. Second, breathing is oxygen flowing into the lungs. Third, circulation is blood moving through the body. If any one of these fails, seconds matter. And that's where years of training become pure instinct. You won't see hesitation. You won't hear a debate. What you'll see is a symphony of action. A choreography where each person knows their role without being told. One team member prepares life-saving medication. Another has their eyes glued to the monitors, tracking vitals. Someone else is constantly communicating updates to the team leader. It all looks incredibly fast because it is. But it's also incredibly deliberate. Every single action has a purpose. And here's something you might not expect. Communication in the EA is intentionally simple. It's clear, direct, and short. In high-stress moments, that kind of clarity saves precious time, and saving time saves lives. Now, let's shift the lens. Imagine you're watching a medical quiz show on TV. A contestant stands under the bright lights, buzzers at the ready. The host reads the question. When a patient is exhibiting classic signs of a heart attack, What is the first diagnostic test you would order? You can feel the tension build. Even sitting at home on your couch, you might find yourself whispering the answer before they do. Electrocardiogram. And when they say it correctly, there's a wave of applause. It's exciting, sure, but it's also deeply reassuring. Why? Because heart disease is still one of the most common emergencies faced worldwide. Knowing those symptoms, that pressure in the chest, the sudden shortness of breath, the unexplained nausea can prompt faster action. And when it comes to a heart attack, faster action saves heart muscle. Time lost is tissue lost. Every minute that a vessel is blocked, more of the heart is damaged. This knowledge isn't just for doctors. It's for all of us. But what happens next reveals something even more critical, because not every emergency is loud and dramatic. Some are silent and subtle. Consider carbon monoxide poisoning. It's odorless. It's colorless. At first, it might just feel like a persistent headache or unexplained fatigue. You might brush it off until it becomes something far, far worse. It's only when doctors run a complete blood count that the truth might be revealed. The test can show red blood cells tragically bound to carbon monoxide instead of the oxygen your body needs. Suddenly, the invisible killer becomes visible. That's the incredible power of diagnostics. They reveal what our eyes cannot see, and that's why those quiz show questions are more than just trivia. They shine a bright light on the silent dangers that can hide in plain sight. Let's talk about something even more human, though: decision-making under pressure. Imagine being asked to make a decision about life-sustaining treatment for someone you love, right in the middle of a crisis. No preparation, no prior conversation. The weight of that choice can feel absolutely unbearable. This is where an Advanced Healthcare Directive can change everything. It removes the guesswork. It replaces agonizing uncertainty with clear instructions. It allows a family to focus on providing love and support, not on speculation about what their loved one would have wanted. In the controlled chaos of that kind of clarity is a gift. It reduces confusion and allows the medical team to act confidently. It provides a clear path forward in a moment where direction is desperately needed. But here's the hard truth. Most adults don't have one. Not because they don't care, but usually because they put it off. The real lesson hidden inside all these medical questions is that preparedness isn't pessimism. It's a profound act of responsibility. And taking responsibility for your own choices is empowering. The emergency room will always be a place of high intensity. But knowledge, both for the medical team and for all of us, helps soften the sharp edges of fear and uncertainty. Now, picture this. A crash cart rolls forward. A nurse calls out, "Charging." The room grows quiet in anticipation. Then a controlled shock is delivered, and then a heartbeat. A steady, stable rhythm returning to the monitor. You can almost hear it. That's why they do this. That's why anyone chooses a career in emergency medicine, for that sound, for that single miraculous moment. But not every story ends that way. And when outcomes are uncertain, when a life cannot be saved, something else remains. Professionalism remains, respect remains, and above all, compassion remains. Because the work of the EE is not just about saving lives, it's about honoring them in every moment, no matter the outcome. Thanks for watching. If you found this meaningful, please like and subscribe for more stories from the world of medicine. Stay safe and be well. Let's slow things down for a moment. Picture this: an elderly patient sitting up, finding it a little hard to breathe. Their hands are trembling and they don't quite grasp what's happening, but the medical team does. They see the low oxygen levels. They know airway support might be needed. The word intubation sounds dramatic in movies, but in reality, it's nothing like that. It's a precise, controlled procedure. The goal is simple: protect the airway. Once it's secure, machines take over the work of breathing. And just like that, there's a return to stability. It's not a glamorous moment. It's methodical. And that method is what saves lives. But there's something else happening in that room. Something just as important. It's reassurance. It's a nurse explaining things gently. It's a doctor speaking with a calm, steady voice. Because medicine isn't just about the technical skills. It's deeply relational. A patient might not remember all the medical terms thrown around, but they will remember the tone. They'll remember if they felt heard, if they felt cared for. And that feeling, that human connection, matters more than we often realize. It can be the anchor in a storm of confusion and fear. Now, let's shift back to the scene of a TV quiz show. The contestants are answering questions with confidence, and the audience is applauding. It seems like simple entertainment on the surface, but something much deeper is happening. It's about building awareness. Because one day, someone watching from their living room might hear the word intubation in a real-life emergency. And instead of feeling pure panic, they'll feel a sense of recognition. That little bit of knowledge can make all the difference. Recognition helps reduce fear, and fear can cloud our judgment when we need it most. When we have clear judgment, we save precious time. But what about the people on the front lines? The staff in the emergency department. These places never truly sleep. They're open through holidays, through blizzards, through the quietest hours of the night when the rest of the world is home. The people who work there witness humanity at its most fragile, its most vulnerable. And yet, through it all, they maintain their professionalism. That's a testament to their resilience. And resilience doesn't mean you don't feel emotion. It means you've learned how to function through it, to keep moving forward for the sake of the person in front of you. Here's something that might surprise you, though. Even in the chaos of an EA, hope is a constant presence. It's not a naive, wishful thinking kind of hope. It's an informed hope, one that's grounded in science, skill, and experience. It's the hope that a blocked artery can be opened, that a dose of oxygen can bring back clarity, that meticulous preparation can prevent a crisis. And that hope spreads far beyond the hospital walls. It travels through our screens from the quiz stage right into our living rooms and conversations. You might finish watching and think, I should probably look into that Advanced Directive. Or, I never knew that's what an EKG was for. And just like that, awareness grows. Quietly, but powerfully. But we're not done, because the emergency room is so much more than just procedures and policies. It's a collection of stories. Stories of strangers who meet under the most intense pressure imaginable and work together as a team. Stories of incredible courage, both from the professionals and from the patients themselves. And sometimes there are stories of profound gratitude. A family member who comes back months later just to say thank you. A patient who walks back into the department, not on a stretcher, but on their own 2 feet. These are the moments that recharge an entire team. They remind everyone why they endure the long hours and the difficult days. Emergency medicine is incredibly demanding, physically and emotionally. But it's the meaning behind the work that sustains them. And that meaning is found in the impact they have on people's lives. Now, imagine this. The quiz show host smiles and thanks the guest who introduced the medical category. The audience applauds, and the show moves on to the next topic. But the lessons from that segment linger, and that's the quiet brilliance of it all. Because sometimes the most powerful education we receive is the kind that arrives disguised as entertainment. Thanks for watching. So what have we really learned? That the emergency room is intense. Yes, that it's complex. Absolutely. But also that it's understandable. Airway, breathing, circulation, intubation, electrocardiogram, red blood cells, Advanced Healthcare Directive, crash cart. These aren't just answers on a board. They're components of readiness, and readiness transforms fear into focus. You may never need to use this knowledge, and I sincerely hope you don't. But if you ever find yourself in that bright, urgent space, you'll know a little more. You'll understand a little more, and sometimes that's enough. Because the EE is not only a place of crisis, it's a place of effort, of coordination, of human beings working at the edge of possibility. You can almost picture it now. A hallway, a monitor beeping steadily. A team moving with intention, not chaos, purpose. And maybe, just maybe, the next time you hear one of these terms, you won't hear fear. You'll hear function. You'll hear preparation. You'll hear hope. And that changes everything. Because knowledge is more than information. It's empowerment. And empowerment travels with you, long after the lights dim, long after the applause fades, long after the final answer is given. The emergency room will always be a place of urgency, but it can also be a place of understanding, and understanding makes all the difference. Over the past few weeks, we've peeled back the layers of this incredibly dynamic environment. We started with the very basics, the ABCs, airway, breathing, and circulation. The fundamental pillars that every single medical professional, from a first-year resident to a seasoned attending, lives by. It's the first thing they check, the foundation upon which everything else is built. We saw how a blocked airway can be a matter of seconds, and how interventions like intubation aren't just dramatic movie scenes, but precise, life-saving procedures. Then we looked at the heart, that relentless metronome of life. We demystified the squiggly lines of an EKG, the electrocardiogram, learning how it tells a story about the heart's electrical activity. Is it beating too fast, too slow, or in a dangerous rhythm? That simple printout gives doctors a wealth of information to act upon immediately. We explored what happens when things go critically wrong, when the heart stops, and how the crash cart, that legendary wheeled cabinet of miracles, is organized for maximum speed and efficiency. Every drawer, every vial, every piece of equipment is placed with intention, ready to be deployed in a heartbeat. We also dove into the very fluid of life itself, blood. We talked about red blood cells, the tiny oxygen taxis of our body, and why a low count or anemia can be so dangerous. We discussed blood types and the critical importance of transfusions, a process that seems simple but is a cornerstone of emergency medicine, replacing what's been lost and giving the body a fighting chance. And beyond the immediate physical crisis, we touched upon something just as vital, your voice. The Advanced Healthcare Directive. This document ensures your wishes are known and respected, even when you can't speak for yourself. It is about maintaining control and dignity in a situation that can often feel completely out of control. Each of these topics could be a whole series on its own, and in a way they are. They are chapters in the grand, ongoing story of emergency medicine. What we aim to do is connect the dots, to show you how these individual pieces fit together into a coherent whole. When a patient arrives, it's not one single problem. It's a symphony of systems, and the EEA team are the conductors trying to bring harmony back from the brink of chaos. They're assessing the ABCs, hooking up the EKG, drawing blood for analysis, and checking for directives, often all at the same time. It's an incredible dance of skill, knowledge, and teamwork. Imagine the pressure. The stakes couldn't be higher. Yet, within that pressure cooker, there is a profound sense of purpose. Every person in that room, from the technician drawing blood to the surgeon being paged, has a role to play. They are all focused on a single goal, stabilizing the patient and starting the journey toward healing. This understanding demystifies it doesn't make it less serious, but it makes it less terrifying. It replaces the fear of the unknown with an appreciation for the known, for the systems and protocols that are in place to save lives. And this journey of understanding doesn't have to end here. The world of medicine is vast and endlessly fascinating. Whether it's learning basic first aid, understanding the medications you take, or simply being more informed about your own health, every step you take builds on this foundation of empowerment. The next time you watch a medical drama or hear a news report, you'll have a new lens. You'll see past the drama and recognize the process. You'll understand the language. So let's carry this forward. Let's stay curious. Let's continue to turn our fear into focus and our confusion into clarity. Because the more we understand, the better we can advocate for ourselves and our loved ones. The more we know, the less we fear. The emergency room might be a place you hope to never visit, but it's no longer an unknown territory. It's a place of incredible human effort, of science, and of hope. And truly knowing that, can make all the difference in the world. Thank you so much for joining me on this journey. If you found this exploration helpful and want to continue learning with us, please hit that like button and subscribe to the channel. it really helps us create more content just like this. Stay safe, stay informed, and I'll see you in the next video.